Hi everybody, my name is Raina and today we're going to talk a little bit about canine hip dysplasia. So canine hip dysplasia is a common inherited orthopedic condition. This is when the hip joint forms incorrectly, which can result in a variety of symptoms such as lameness or limping, reluctance to jump, loss of muscle mass on the caudal vertebrae, also known as the hind end of the dog, and overall arthralgia, which is joint pain. Hip dysplasia is a chronic condition. Although it can be treated, it is still a lifelong issue that can develop chronic pain. If not treated, it could lead to other conditions such as early onset osteoarthritis, or even a possible total hip replacement. Hip dysplasia is becoming more and more common, especially in large breeds. Let's see. This is very painful, and it could also reduce the quality of life for the pet. So the body's natural response to the joint damage caused by this condition is inflammation, which is the leading cause of this pain. Canine hip dysplasia can be diagnosed through some x-rays. Sorry, it's a little blurry. Let's see. So for x-rays, the standard view is a ventral dorsal hip extended, which kind of looks like this. This is typically a view that you could kind of tell right away if a pet has canine hip dysplasia, for example. Here, it looks pretty normal. Nothing looks too weird. And then if you look on this side, you could tell we have a little bit of abnormal abnormalities, especially over here on the left end of the pet. You could definitely tell something is off. Let's see. But there is a more advanced approach. It is called the pen hip radiograph series. It's usually done under anesthesia. And it involves 3 different views, one being the standard hip extended view, as well as a distraction view, which is seen here on the bottom. The distraction view is the hip joints are pulled apart to measure how much the ball can be pulled out of the socket. So you can see here. And then there's also a compression view up on the top. And this view is when the hip joints are pushed together to evaluate how the ball fits into the socket. Yeah.